So my name is Meri Larivaara, and I'm joining this webinar from Finland, from our capital area. And I am a medical doctor. I am a specialist in health services. I also have a PhD in public health. But aside being medical doctor, I'm also a cultural anthropologist. And I'm now working at an NGO called Mieli Mental Health Finland, where I'm the director of adult mental health promotion. And so I am actually going to talk about mental health and not really about mental illness. And we'll see now whether I can share my slides. So here is the map of Finland. And I would like to point out that Mieli Mental Health Finland is actually the oldest mental health NGO in the world that is still working continuously. So we are going to be 125 years next year. And we are focusing on promoting mental health and preventing mental health problems. So we are not working on mental illness really, but it's about promotion. And for instance, we advance the mental health literacy of children, adolescents, adults, and the elderly. We are also coordinating a national network of local mental health associations and national crisis centers that are supporting people in different kinds of life crises. But then about our approach to mental health, we are really using the WHO definition of mental health and mental well-being as our starting point for our work. So the idea is that mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively, or is able to make a contribution to their community. So as you can hear from this, it is really about sort of like a resource in life and not so much about disturbance or disorder or even a stressor or stress factors. And so I wanted to share this picture with you as well, just to give you an idea of what we are talking about when we are talking about mental health. It can be many other things as well, whatever comes to your mind that is related to mental health, but many of these things are very positive. I'm not certain if you can see them really behind your screens, but there are things like life balance and well-being, or ability to love, or awareness of one's own potential, or optimism, or mental growth and development. So a variety of positive things that are really related to all of us. So what I often like to say is that mental health is something that we all have, while many people tend to think that it's actually about mental disorders that only some people have. So also I would like to point out that there are different factors that influence our mental health and that really influence whether we have good mental health at some point of our life, or whether our mental health can be also sort of diminished at some certain points of life. Mental health is also an asset that can be strengthened or that can be really sort of strained, and that can decrease when we have difficulties in our life. But we have individual factors that influence our mental health. So this is about biology, but it's also about learned skills and our experiences in life, what kind of a life course we have had. Then there are social and interpersonal factors that influence our mental health, and also the structural factors in society. For instance, what kind of safety nets do we have in a society? And then it's also about cultural values. Then I wanted to share with you this picture that really explains that mental health, the relationship between mental well-being and mental health disorders. So they are actually two dimensions that are related, but they are not really, but they are still independent. So when we look at the two dimensions where we have good or poor mental well-being, and then the presence of mental health disorders or not their presence, we can actually create a picture where we have four corners. And in these corners, we have different situations with mental health. There can be, for instance, a person who has a mental disorder, let's say, for instance, a bipolar disorder, but yet the person can have good mental well-being and can live and lead a balanced life and can actually enjoy his or her life. very nicely. Well, then I would like to make a point of the fact that the significance of mental health is increasing in our societies. It is partly because work is changing. Our mind is increasingly a crucial tool for us at our work. Also, we have more opportunities and requirements to make choices in life, and that requires mental resilience. It requires lifelong learning, and it also requires ability to make independent decisions. Also, our values and lifestyles are becoming more varied, and that also can create challenges to our mental health. And then there is all technological development. There are other sort of trends in our societies as well that can be a challenge to mental health, but these are really issues that are making the relevance of mental health increasing. Then I wanted to say something about how we perceive in Finland the idea of promoting mental health. We really think we need to work across policy sectors and apply health in all policies also to mental health. For instance, we think we should build everyday environments that have practices that strengthen mental health. For example, they can be schools or workplaces or our leisure time activities. So it is not so much about social and health services, but more about the environments where we are living. Then it's about interactions and encounters that strengthen resources and resilience in us. And then it's also about mental health awareness, mental health literacy, and mental health skills for professionals who meet people at different sectors and for lay people of different ages. As for mental health skills, I wanted to give you an idea what we mean with them, because it's not always so obvious to everybody. So we think mental health skills include emotional skills, self-awareness skills, life skills, interpersonal skills, problem-solving skills, and the ability to seek help. And based on these ideas, we think really that mental health is a resource that can be strengthened in each and every one of us. And in Finland, for instance, we actually teach these skills nowadays at school to children as part of our national curriculum. But I think these were all my slides. No, there was one important slide that actually resonates nicely to the COVID-19 pandemic. We have been talking about herd immunity to the COVID-19 virus, and it's really an important issue when we are talking about vaccinations. But actually, we have this sort of an idea in Finland that when most people in a community have mental health skills, even those who are more vulnerable will be protected, and that can create us a herd immunity against mental health problems. So that was my last slide.